Thank you, Minister, and good morning. So I'll start with the local outbreaks to our Delta and Kappa outbreaks from this month. I am pleased to confirm that today the last public exposure sites related to these outbreaks will come down, having passed the 14-day mark. That includes the Kings Park complex with around 200 residents formally cleared at midnight last night, having had their day 13 test results and completing their 14 days. That doesn't mean the risks of these outbreaks are over. We still need to be sure there's nothing circulating residually. We still need to pass 14 days for all of those primary close contacts, some of whom aren't connected to the public exposure sites. But we are in a very good position. That's not a boast. That is, we've all been humbled by this virus. That is an opportunity to thank contact tracers in my team, all our local public health units, but most of all Victorians, because it has been, as it's always been, a huge collective effort and sacrifice of everyone across the state. Everyone who got tested with symptoms, everyone who isolated for 14 days if they were exposed. To steadily stamp out simultaneous outbreaks of Delta and Kappa variants is no small thing. We hope we're there. So huge thanks to everyone who followed the specific public health advice, which is not an easy task, and the millions of Victorians who changed the way they lived and they worked every single day to keep us all safe. To the case of the cabin crew member who flew into Victoria on VA 334, of the more than 100 passengers and crew we're managing as primary close contacts, 77% have already returned results, all of them negative. We're also seeing negative results coming through on other cabin crew and airport workers on the ground and among people who stayed at the Holiday Inn Express. And there are no updates of note in relation to the Sandringham workplace outbreak, with more negative results rolling through. So we're in a stable position. In terms of the key interstate outbreaks, I can confirm that Victoria is managing 6 primary close contacts linked to the Northern Territory gold mine site. They've all quarantined, they've all tested negative. The National Incident Room are leading the coordination of this contact tracing exercise and supported by other states in terms of the allocation of tasks to phone each and every close contact. We thank them for all of their work in that. Finally, the Perth and Peel regions in WA entered lockdown in the early hours this morning, and as we've just heard from Premier Palaszczuk, 11 local government areas in southeast Queensland, from Gold Coast to Sunshine Coast, and then Townsville, Palm Island and Magnetic Island are going into a 3-day snap lockdown from 6 p.m. today. So for Perth and Peel region and all of these regions in Queensland, they'll become red zones from 1 o'clock tomorrow morning. As part of that timing, people on flights to Victoria scheduled to leave before that cutoff will be able to enter on their orange zone permits, and red zone permit holders who are Victorian residents can continue to enter Victoria in a controlled way in those more limited numbers, but will need to have their home quarantine for a formal 14-day period. Through to 3 p.m. yesterday, of the 13 flights from Sydney into Victoria, 370 red zone permit holders entered. Our household engagement teams continue to visit the red zone permit holders, as well as working through visits to our remaining primary close contacts. A final reminder to orange zone permit holders, especially from regional New South Wales, you're required to isolate on entering in Victoria and get a test within 72 hours, within 3 days, and staying isolated until you've got that negative result back. If you're crossing the border from New South Wales, you don't have to go to the very first testing stop to get a test. You can come to your home. You can stop for essential reasons, toilet stop, petrol stop on the way home, as long as you're wearing a mask and you only do the essential activities on the way. So you can still get that test within 72 hours as long as you're isolating until you've got that negative result. So as a final reminder, please get tested if symptomatic or if you've got it as an obligation of your permit. Get vaccinated if you're eligible. Get a permit every time you're entering Victoria. And for QR codes, check in everywhere, every time. We we were able to cross-reference our permit zone applications with the Northern Territory miners who entered Victoria. That was a really straightforward exercise. It was an instant way for us to ensure that the list that we got was cross-referenced against those permit applications. So they're really important for our contact tracing purposes, and they're already coming into play for these current really dangerous outbreaks around the country. Thank you.
Happy to take questions.
Thanks, Minister. Look, my understanding is the announcement from last night suggests that there will be eligibility for those 18 to 39 to receive AstraZeneca. Currently, for those who are already eligible under the national prioritisation, so healthcare workers, quarantine workers, aged care workers, etc., if they fall in the 18 to 39-year age group, they have always had the opportunity and availability of AstraZeneca vaccine should they choose it. And some of them might choose it, especially if they've had a deferral in terms of the Pfizer availability and they want to get vaccinated right now, or indeed if they just prefer the AstraZeneca vaccine from their own conversations with their GP. But the formal notification of the open eligibility for everyone 18 to 39 years of age is yet to come from the Commonwealth. And the Minister's referenced that this morning.
But unless there's a case in a border town, do you still plan to keep those border towns green zones? Is there some concern on the border about the hard border coming into play?
Yeah, look, I'm certainly acutely aware of what the challenges are in the border local government areas and the daily movement of people for their normal work and normal activities. We will try and keep those areas as freely moving as we possibly can. But of course, I'll make a consideration if there are really any signals in regional New South Wales, whether it be a wastewater detection or exposure sites popping up there because a case has moved through, or indeed a transmission event and a case being present in regional New South Wales. But we will do our utmost to try and make the operations across the border as safe but as straightforward as we possibly can.
Are you confident that AstraZeneca is safe for people under 40?
Absolutely. Clearly, ATAGI have provided advice, and it's a balancing of what the clinical risk is with the very rare instances of serious clots, very rare, against the risk of being exposed to COVID. We're at a point now where it's the most dangerous that Australia has looked in terms of outbreak potential for a long, long time. And so the advice will always change in terms of that risk, the risk of people being exposed to coronavirus through substantial outbreaks across Australia. So that advice from ATAGI has changed in line with, our risk of potentially getting COVID infection. But they've always been clear that the risk of serious clots is very, very low, in the order of, 4 or 5 cases per million. So it's a vaccine that's had hundreds of millions of doses provided around the world. It is a vaccine where tens of millions of doses provided in the UK has gotten it from its peak of 60,000 cases a day right down to 2,000 to 3,000 cases a day. They're seeing a challenge with the Delta variant. They've gone up to close to 20,000 cases a day. However, and this is a really important point to make, the daily deaths that they're seeing is still in the 10 or 20 people per day. Still tragic, but much, much less than the 500,000 deaths that they were seeing at the peak of their challenges. So the AstraZeneca vaccine is providing protection from hospitalisation, from severe illness and death, even with the Delta variant. And people need to bear that in mind, that the Pfizer vaccine is very protective against dying and serious illness for the Delta variant. AstraZeneca vaccine, especially 2 doses, the same. That is a really important point to make. So, I'm getting mine in part for that reason, in part to do my job of helping to get to the kind of immunity level in Australia that will reduce the risk of these outbreaks and clusters. I know Minister Hazzard referenced the Hoxton party. That was a really important anecdote for me, that 24 of those attendees who were unvaccinated, all of them got infected. and for those who are vaccinated, they have not turned positive. The lesson there is that maybe for those people who have those fleeting contacts or limited single event contacts, that getting 1 or 2 doses of any vaccine can provide that protection that helps stop these outbreaks and clusters from propagating. That's a really important anecdote.
On the entry aged care jobs, will aged care workers have a choice of the vaccine they receive, and for those that refuse, will they be sacked straight away?
Look, we're a long way away from settling the exact details. Obviously, it's been flagged that mandating a vaccine for aged care workers is to be implemented by mid-September for their first dose. I've been clear from a Victorian perspective that all of those other barriers need to come down. So the communication engagement, the understanding of the pros and cons of those vaccines, the accessibility and supply issues all need to be dealt with before you come over the top with a mandate. It's a significant step, but it's one that recognises the real vulnerability of residents in aged care and the fact that aged care staff have inadvertently been a mechanism for introducing the vaccine into those very vulnerable settings. So it's an important step to go to if there's a significant benefit against the risk equation for that. But the legal instruments and the consequences need to be worked through. It's just been announced yesterday.
Do you think other frontline workers should follow suit eventually?
Look, it's not a current recommendation of mine. It's clear that the most vulnerable settings overwhelmingly remain the aged care settings, but we'll see what happens when you've got supply issues addressed, when you've got all of those other barriers, whether they relate to vaccine hesitancy or information provision, and the distribution and accessibility. The PM spoke of the sick leave arrangements. All of those barriers that might currently lead to less than ideal coverage need to come down, and we'll see where we get to by virtue of that.
Whenever we talk about widespread vaccine coverage, particularly here in Australia, we obviously have a comparison of the UK, the US, that has 50, 60, 70% of their population vaccinated. We hear from the federal and some state governments say, well, UK has 60% coverage, but they're still having tens of thousands of cases a day. Do you think that's fueling vaccine hesitancy in Australia that already has serious vaccine hesitancy? And do you think it's time for governments to start talking about what a post-vaccine world could actually look like?
Look, I don't think so. We have to speak to the facts as they exist around the world. The fact is, countries with high vaccination coverage can still see spikes in cases, can still see these resurgent waves, largely driven by the younger population who maybe haven't yet gotten their second dose of vaccine. That probably applies in the UK. The eligibility for those under 30 years of age has only opened up recently. And so we'll see how that plays out. However, as I've just addressed, the fact of protection from serious illness and dying is a really critical one to reflect on. And so even in places like the UK, Delta variant taking off in certain states in the US, Delta picking up in Israel, they're still seeing very small numbers of people dying compared to where they've been historically. That's a really important thing to reflect on. I hope that is something that a vaccine hesitant person would reflect on and say, well, it may not be a perfect vaccine. There are probably no perfect vaccines, but it's going to protect me, it's going to protect my family, and especially vulnerable members of the community from the risk of dying. That's a really important thing for everyone.
Given the low instances of death from COVID, particularly in those populations that have been vaccinated compared to where they were maybe 12 months ago this time, do you think governments need to sort of start emphasising those figures more? And in order to incentivise people to get vaccine, talk about a post-vaccine world?
Yeah, I think so. I think there are important reflections that are happening around the globe now about how people are returning to a much more normal way of life with high vaccination coverage. That's something for us in Victoria to reflect on. But, you know, it's not enough just to have the motivation to get vaccinated. We don't want people to be clashing against a really constrained supply. So when the time is right and supply is really plentiful, we'll absolutely push that messaging. But right now, what we want to say is, if you're eligible, with the understanding of some of the constraints in supply, please come forward and get your first or second dose now.
Brett, what's your advice to people who are already holidaying in the Gold Coast? Should they rush back now, or could they wait it out and say at the end of this lockdown in 3 days will the red zone be lifted?
Look, it's very difficult for anyone to make predictions about red zone declarations. We've seen the Northern Territory extend their red zone declaration for another few days. There could be new cases emerge, so people need to make their own judgments. You know, it's fair to say that it's not much of a holiday if you're in a red zone. You'll be locked down. If people want to do the right thing, the main thing is to follow the instructions of that jurisdiction. So I would say to anyone in Queensland, listen to the advice of the Queensland Government.
The Premier's been quite emphatic the past 2 days about cutting the number of return travellers to Australia as a means to avoid lockdowns. Is any of that based on health advice from you?
No, look, it's not. It's a matter of national policy and national cabinet decision making. I mean, it's clear that the public health principle is pretty straightforward. The greater the volume of international arrivals, the greater the risk. It's kind of a linear relationship. But it is a matter of weighing up those really difficult considerations around you know, people with strong humanitarian cases to return and the very many people who remain stranded overseas.
States, including our own in WA, have cut the number of return travellers without waiting for a national cabinet meeting. Are there any plans on doing that in Victoria?
Look, that's a matter for First Ministers across the country.
But not based on your advice?
Not based on my advice.
A vaccinated woman in New South Wales quarantine who is attempting to get to Melbourne to see her dying father has been told she'll need to pay $7,500 for a chartered flight. Will the state government commit to allowing her to enter the state, and why can't some sort of compassion and common sense approach be given to cases?
Look, that exemption case hasn't come to me. I know the minister's spoken to his counterpart in New South Wales. Firstly, the allowance to leave New South Wales and the means by which that individual can leave New South Wales needs to be agreed. We'll work cooperatively with New South Wales to make it happen if the exemption's provided from our side. But these are compassionate cases that I'm very happy to try and support in whatever way I can. As I say, it hasn't come to me for a formal decision, in part probably because the assurance from New South Wales about the mechanism to leave the state needs to be agreed in the first instance. I don't know if the Minister wants to say anything further.
Expertise, what Victorians should expect that we are aiming for?
I saw something in social media from Julie Leask, a kind of legend in vaccine hesitancy and vaccine comms and engagement. She said the answer is 42. So it's, she was making a joke about the fact that you really cannot pin down something in a dynamic, changing circumstances about who's eligible, what variants of concern are circulating, and the level of transmission that you've got within a country at any one time. So. You know, for me to throw out a number, it'll be grabbed and it'll be wrong. So I won't do that. It does need to be higher than we're at currently, and the higher that we can attain, the better off we are, both with the variants of concern that are circulating now, but also to kind of future-proof against even more transmissible, even more severe illness into the future. We should aim as high as we possibly can.
Minister Foley.
Sorry, are we going to offer to host State of Origin or rugby union games later this month?
Look, that'll go through our public health assessment panel. It'll come to me formally, but look, it's probably only going to come to the panel if there's a request from another jurisdiction or indeed the code for it to come to Victoria. I'm not aware of that.
Are we close to increasing crowds at the AFL, or is that once the restrictions ease after the full 2 weeks?
In process at the moment, hasn't landed.
Minister Foley, can I just ask you one final question?
Yes.